So in summary, what you need to know is it has to be the transdermal way for the estrogen. You need to take a real progesterone also. So what about estriol that a lot of times people see made in accompanying pharmacies with actually estradiol? So there is a logical basis to it. We know that actually estriol is produced mostly during pregnancy. And we know that pregnancies do have a protective effect on the breast cancer. And why is it so? First of all, we have to know that there are three different types of estrogen. Estrone, which is produced mostly by fat tissue and after menopause. Estradiol, which is produced during the reproductive period of women. And estriol, which is produced during pregnancy. Actually, estrone, which is produced mostly in fat tissue, does have more tendency to stimulate what we call the alpha estrogen receptors, which do actually stimulate the nucleus of cells and have a more tendency to induce anomalies at the level of the nucleus and possibly cancer. At the level of the breast, there are two different types of receptors. The alpha receptors that actually stimulate proliferation of the breast cells, and the beta receptors that inhibit the replication of the cells. And the different hormones do not have the same ratio of effect either on the alpha receptors or on the beta receptors. Estrone has 5 times more tendency to stimulate the alpha receptors than the beta receptors. Estradiol is equivalent, actually, the effect is equivalent on either side or the other. Regarding estriol has a tendency to stimulate the beta receptors 3 times more than the alpha, which means that it does inhibit the proliferation of the cells. So whenever actually people are fat and have a tendency to have much more estrone, which has a tendency to increase the risk of breast cancer, it might be logical to supplement them with estriol, which has a tendency to lower significantly that risk, so that estriol will compete with testosterone at the level of the receptor to decrease the risk of breast cancer. So, yes, there is some logical foundation to that. However, we don't have yet enough studies or medical studies to justify completely its use, but it does not seem it could be harmful.